the live stream. Okay, just a second. Just a second. We're going to start in a minute. Can you still hear me? Okay, I'm just waiting to see if it's okay. Okay, great. We're on air. So, hi, everybody. This is Dr. George. Dr. George is going to explain to us a very interesting subject about bone marrow procedures for autistic children. He is the founder of stem cell therapy in Vienna. And from now on, the stage is yours, doctor.
Okay, thanks. Thank you, Shira. So, I wanted to talk to you. We started out with stem cells some 12 years ago. And actually, we started with cerebral palsy children. And then some children with autism dropped in. And with growing success, it was kind of a self-fulfilling prophecy. More and more parents would come for having their children treated with stem cells. And now we have some 735 treatments made among a total of 3,000 bone marrow punctures and 3,000 treatments. So that's quite a number, and it may be the largest in Europe, in spite of the fact that we just started a few weeks ago to have a web page, and it doesn't even mention stem cells. And because we were cautious, it's always good not to give too many hints to the authorities. But we have in Austria a very stable situation. Fortunately, we have confirmed by the highest court ruling that stem cell therapy can be performed, and it's fully legal. We also have a permission from a Ministry of Health, and so that gives us a lot of security, and we are happy. What we'd like to have is that social insurance will come up for the costs, because we know it's a terrible task for parents. They have to pay for so many things, many tests, psychiatry, all the other treatment. It costs a fortune. The logotherapy costs a fortune. And finally, and then parents come to Italy, to Dr. Antonucci, and they have all the mineral treatments. And somewhere in the end, they come to ask for bone marrow puncture and bone marrow transplantation. The most important turning point in the treatment of autism actually comes from Israel. And my close friend, to whom I just talked a few minutes ago, he wrote an article about the biological basis of autism. Autism was first described in 1943 by Kenner, who comes from Vienna but had to go to New York for obvious reasons. And he described a young child with typical autistic features. And at that time, it was a rarity. A child with autism was something you could see in a lecture at the university, but that was it, and never again, 1 out of a couple of hundred. Now, it's 1 out of 38, the latest numbers in CDC, Center of Disease Control in the US, says 1 out of 33 children suffer from autism. So it has become a pandemic, definitely, much like, well, COVID or whatever. And the turning point I told you was that Benny Gesundheit described that the cause of autism, which has been studied for 80 years, since 1943. It's not so much psychology, some problem with psychiatry, the children didn't have good parents or whatever. It's all nonsense. No, they have a biological basis. There's a biological groundwork for autism. It's a disease just like arthritis. You wouldn't say arthritis is a psychological problem. You wouldn't say morbus Crohn, the disease, colitis. It's a psychological disease. Those are biological diseases. And also autism is a biological disease. And this is the turning point. So we can treat autism with biological methods. And logically, drugs will never work because it's an inflammatory process in the brain. What you can do with drugs is calm down the child. There are 2 drugs that are allowed for treatment of autism. It's risperidone and Abilify, that are drugs that are important when the child are uncontrollable. They are self-aggressive, aggressive to others, then you need these drugs, certainly. But it doesn't cure the disease. It doesn't attack the cause of the disease. The cause of the disease, that's what Benny Gesundheit described, was an immunologically based inflammatory process of the brain. And it looks like that this inflammation happens primarily in the left temporal lobe, where speech is located. You know, if you have a stroke on the left side, you can't speak. If you have a stroke on the right side, at least you can speak. But on the left side, your speech is gone, usually. Same thing happens with autistic children. Lots of parents tell us, well, he started to speak, he said a few words, and suddenly he regressed, and he no more spoke. So this is not something that happened in the psychology of the child, but it happened in the brain due to inflammation in the area where speech is located. And the strange thing, or I don't know how to say, when you take away this inflammation, children start to speak. 50% of the children we treat start to speak after the first treatment. So that's a lot. I mean, it's 50% more than with most other treatments. Because the inflammation is gone. I wondered at the beginning, hey, I'm curing children who don't speak, and parents report, well, he speaks, he's bilingual now. How come? How does that ever happen? It's just the stopping the inflammatory process. And then when speech comes back, children get their self-confidence and they start to socialize. Not to socialize may have another reason. Children do not have enough oxytocin, which is a hormone which makes us social, which gives us pleasure. It's also the hormone that the mother needs when during delivery during childbirth. And it's the hormone, it's a trick of the nature. It's used to contract the uterus muscles. But then it's the same hormone that makes the mother very social and love her child. She loves the child no matter what he looks like. They all look pretty. They're the most beautiful babies. We all love them. And I know I've had 2 babies and it's the best moment in life. But there's a hormone behind it and it's oxytocin. Children with autism lack oxytocin. So giving oxytocin intranasal or sublingual may alleviate the problems of social distance. And there is the stereotypical behavior. They repeat things. As soon as they become more aware of where they are, what they do, they stop this. So a lot of it comes from speech. As I said, taking away the inflammatory process, it helps regaining speech just like any other child. They don't start to speak the next day, and they don't start to give speeches the next month. They start to speak like every child because now they do the same process in their brain like they would have done or they started to do when they were 1 year old. The question that you are facing is, once you recognize and you're willing to accept the fact that stem cell therapy is the therapy for autism, because it's a biological disease, it's an autoimmune disease, and as for now, that's the only treatment for autoimmunologically caused inflammation in the brain. Which type of cells? There is primarily the umbilical cord stem cells, umbilical blood stem cells, embryological cells, mesenchymal cells, placenta cells, bone marrow derived stem cells. I must say, we are not at the end of the story. We are in the middle of trying to find out what's the best. As for now, if you look at the literature, autologous bone marrow is the treatment with the best scientific background. You may say, well, there's a lot of literature in umbilical cord. Well, you may know that the Duke's University was very much fond of umbilical cord stem cells, and they had their web pages full of advertisement. Now they don't advertise at all because they had to publish a paper, a phase 2 study that showed that the effect of umbilical cord stem cells only happens in children with a high IQ. Children with the lower IQ do not benefit from the umbilical cord therapy. There may be other studies that may show the contrary, but that was a very good study, and that's what we know for now. There are no studies with embryological stem cells. Embryological stem cells is something that you get in Kiev. You want to go to Kiev. I don't think it's a safe trip now. And once you know how those embryological cells are harvested, you may not wish to have them. Lots of the embryos that are used for getting the embryological stem cells, they tell the mothers, well, your child is sick and it has a malformation, you should have an abortion. And there was a movie report documentation about this. And the mothers agreed to an abortion, and an hour later the embryos are in the clinic and used for embryological stem cell transfer. I'm not saying it's bad. Embryological stem cells have an incredible potential, but there's a lot of moral issue about it, if you want that or not. And there's a slight risk of tumor formation, which may be very small. There was one case of teratoma reported that was 20 years ago. And then I think the whole thing was abandoned. So that's
we actually had a patient in our hospital in 2005 with embryonic stem cells, and he also had teratomas. But I think it's best because I think that all of the patients here are interested in what you do. So if you can explain the process, I think it would be now a good focus to do.
Okay. What we do is we use the bone marrow of the child. We puncture the back of the hip bone, the posterior, spina iliaca superior and inferior, and the anterior aspect of the hip bone. We try to do many punctures because the more punctures we do, the more cells we get, and the better the cell count is. You can also take the cells from the head of the tibia, of the shin bone, which has a little bit less cells, but it's also good, certainly. And we can take a lot of bone marrow. We can take in between 40 and 140, and maybe even more bone marrow. We put that in a machine that centrifuges the bone marrow and separates it into 3 different compartments. The highest is the plasma, which in most clinics, it's not used, but it's rich in interleukins and growth hormones. It's rich in secretomes. Secretomes are, again, hormones that are secreted by the stem cells when they die. And this is an important part of the whole story. Matter of fact is, I don't want to get into too much detail, but the secretomes are an important part in stem cell therapy. And there are doctors who believe that those hormones, paracrine factors, are as important or more important than the cells themselves, because they feel that the cells eventually die away, and the hormones are the substances that really make the treatment. I don't think this is totally true. There are 2 phases of improvement. The one is a very fast process, 1-2 weeks after the stem cell procedure. That's the paracrine effect, the hormone effect. And then there's a stem cell effect, which usually starts 3 months after the procedure. So I think both components are important. And what we do is, well, you have the plasma, then you have a small portion, which is called buffy coat. It's a white layer in between plasma and red blood cells. And that's where the mononuclear cells are, and that's where the stem cells are located. The secret is to take out the small portion in between plasma and red blood cells and use it for the transplantation. So we have a machine that with an infrared beam separates the plasma and the red cells, and it segregates the buffy coat for us. And then we have the red blood cells, which we either give back or we just dismiss it. Usually we don't need them. But what we need is this buffy coat and the portion of the mononuclear cells. And the nice thing about the bone marrow is that it's not just one stem cells. We have about more than 100 different stem cells. You have dental stem cells, you can have cardiac stem cells, you can have stem cells from almost any part of the body. But when we take out the bone marrow, we have at least the CD34 hematopoietic stem cells. We have the progenitor cells, we have mesenchymal stem cells. So it's a bunch of stem cells that work together like in a clockwork. And they do, if you only have one stem cell, like neurological stem cell, that sounds great, but I have not seen any more convincing success because they may lack some other stem cells that may be important. So this mix of stem cells with predominantly hematopoietic stem cells seems to be, at least for now, the best shot at stem cells. This is true for kids with no inherited disorder. If they suffer from glucose 6-phosphate deficiency, if they have SCN1 alteration of their stem cells, they may be a different set of children, and they may require allogeneic stem cells. But that's another story. You have foreign stem cells.
Doctor, can you repeat the two kinds of patients that should not come for self-donation and go for allogeneic donation, so I can write it down?
It's any, I mean, there's thousands of inherited metabolic disorders. And parents write, our child has DiGilio disease, thousands of diseases. And
a child has only a child that's also autistic, but also has genetic metabolic disorders.
No, the majority, I mean, let me explain. If genetics were responsible for the propagation of stem cells, of autism, this does not explain the rapid increase. It cannot happen by just genetics. It's impossible. Genetics cannot multiply so fast. There may be, I mean, there are like 110 different genes that are brought in association with autism, and they may have some association. Our explanation is that the metabolic disorder or the genetic disorder may be a lack in detoxifying enzymes. It's not autism per se, but it's a lack of the capability to detoxify. And this, in turn, then causes autism because there's an accumulation of many toxins that you can find: aluminum, mercury, mangan, copper, strontium, technetium. We have 50 different heavy metals that are found in conjunction with autism. So genetics may be a part of the game, but it's not that there is one gene that causes autism. And if there are parents that have siblings with autism, it's our assumption, yes, there are we have siblings, one child has autism, the other has none. So this is not really proven that a genetic part in autism is not a proven fact. There are a lot of suggestions, there are a lot of links, but it looks like that environmental issues. The children live in the same area like their siblings, like their parents, maybe just as important than true genetics. And as I said, that's something agreed on by all doctors. If autism was caused by genetics, this does not explain the rapid increase in autism that we face now. But as I said, it may play a role due to deficiency in detoxifying metabolism in mitochondrial disease. So there may be certain parts of the story that come with the genetics, but it's not, there isn't a gene for autism that has not been shown.
Can I ask you to be helping now? I have a lot of parents here. They
Yes.
want to know what they need to do so they can come for treatment at your establishment.
Well, the easiest thing is we have an email, and this is office@sct-vienna.com. So I hope this is correct. Yes. Or you can go to our webpage, kobiniamed.com. Okay. And then it shows our team. It's not an advertisement. We never advertised. And in spite of that, we've done so many. It's all word of mouth. But yeah, those are the two ways to contact us. I think that's the best way. And then if you want to write us and have a fast way to get a treatment, please, we need one documented diagnosis. I am not a psychiatrist, and I am not allowed to make a diagnosis of autism.
Okay, so you need diagnostics for autism.
Yes.
What else? What other kind of documents my patient needs to get to your clinic?
What we need is some blood work. I write down the most important ones. This is total blood count, which is the red blood cells, white blood cells. It's coagulation parameters, PT, and it's PTT, which is INR. The conversion of it is INR, which are the coagulation parameters.
Okay, so
Latex.
when they contact you,
Yes.
can they get referring documents for blood work?
The important thing is we need the diagnosis. I cannot accept any child without the written diagnosis from a neurologist, from a psychiatrist. This has to be seen by a specialist. I'm not a specialist for neurological disease. That's what a lot of neurologists try to kind of get rid of me. They say, as a surgeon. Yes, I'm a surgeon, and I do the surgical part of the treatment. And that's important.
So step one, we've done. We've sent you a written diagnosis.
Yes.
And you have referred us to blood tests, which we have given back.
And then you have the blood tests.
Okay.
Then you say, you tell us when would you have any questions. We send you a lot of literature if you want. We want you to learn as much as possible about autism before you come to us. So you better understand what we do. There is tons of literature. I mean, I can just to show you.
I think that what I will do is
Okay.
after the lecture, I
Yes.
will put it in a link below.
And
now,
then
we have done literature. We have sent you all the information what happens after?
And then you tell us when would you like to come, okay?
Is there a doctor consultation first?
If you want, you can have a video call with me. This is
Okay.
not a problem. Most of our teaching is in what we have published. So usually if you type in Kobinia, autism, and or ask us for literature, we send you literature we've published. And this is very precise, more precise than I can tell you now. That gives you all the information that you want.
Okay. So how long, so the child has booked now a date?
Yes.
How long before procedure they need to
Well,
come?
in order to book a date, we need to make an arrangement with the clinic. We need to make an arrangement with the pediatric anesthetist. We need to make an arrangement with the pediatric nurse, with intensive care pediatric nurse. We have 6 people staff when we do the operations, and we need a deposit.
How much money do you need to deposit?
3,000 euro.
3,000 euro. And how far before treatment they need to pay the deposit?
Whenever you want to make the appointment, usually it's 1 month before the treatment.
Okay. And
But
so
if you want to,
the deposit, now we're good to go. And the day before treatment, they pay the rest.
yes, which is
And
9,000
together,
euro,
it's going to be how much?
a total of 12,000.
12,000. So 3,000 before, 9,000
Yes.
the day before.
And it's a
And
total
when
of,
they arrive to your clinic the night before, or you
Yes.
need them to come a few days before to do some testing?
well, let's say when we do the operation on a Thursday, you should be here on Tuesday to accommodate. You see me on Wednesday, and we discuss all your documents. We discuss all your history, anamnesis. We discuss any possible diseases and all side effects of the procedure, any question that you may have.
Okay.
It's about an hour, so you have 1 hour time to talk to me.
Okay, great. So now this is the morning of procedure. Can
Yes.
you walk me step by step what's going to happen?
And well, the morning of the procedure, we pick you up with a taxi, with a car. We bring you to the clinic. There, the child receives usually a spoonful or a syringe with honey and dormicum, which makes the children sleepy, and also with ketamine, which is very good for autism and makes them forget everything. So we rarely, really, I can tell you, rarely have big issues about putting in the IV needle. We also like to give kids CBD oil before the procedure, which helps them to calm down and makes them more quiet. And we rarely have a child that cries a lot and 5 adults have to lie upon the child. This never happens. We have the anesthetist and we chat with the child if he's still awake. Usually they sleep, and then we put in the IV needle. And once the needle is in, we put them to the OR, and there they get the propofol. The propofol they get already in the intensive care unit where they are prepared. So when they go to the OR, they are asleep. They don't know what's happening.
I just want to make sure with you, because I will be asked, these children, when they receive propofol, they are now intubated, right?
No, they're not intubated.
No intubation.
It's a so-called pseudoanalgesia. I type this because that's a word that you may wish to know, pseudoanalgesia, which means the children sleep, they still breathe, but they are not intubated. We never have intubated a child.
Okay.
And then we put them in a lateral position, which is the best and safest position for any situation that may occur.
So lateral position, for whoever
Lateral
doesn't know, is
position.
lying on your side.
Yes. And then the child is scrubbed surgically. We work in an OR with laminar airflow, which means it's a sterile air, which is not necessary. It's not legally necessary. We do it because I was a heart surgeon, and sterility is the highest priority for me. So we scrub, we drape the child, which is also not done in all clinics. Most clinics do the bone marrow puncture without draping the child or the part of the body where we take the cells from. And then we do the punctures and put the bone marrow immediately into a collection bag, which is transferred to the machine, which processes the bone marrow. From there, it takes about 20 minutes, 30 minutes to process the bone marrow. We take out the plasma, we take out the bone marrow concentrate, and we inject something in between, according to body weight, 3 to 10 milliliters into the cerebrospinal fluid, which is via lumbar puncture, the so-called lumbar tap. This is a procedure that is done 10,000 times a day all over the world because it's the best diagnostic tool for finding out, does the child have meningitis, does he have any disease in the brain? And in children, it's very straightforward because they don't have osteophytes, or their bones are still nice, and you can nicely go in between the vertebrae into the dural sac and get out the cerebrospinal fluid and inject the 5 ml of bone marrow concentrate of the stem cells. The rest of the stem cells goes IV, and then we also inject IV the plasma, the whole set of plasma, which is a very important part, as I said, because it's rich in growth hormone, it's rich in interleukins, and secretomes. So those are the very important things which I learned from a colleague of mine. This was actually discovered in Vienna many years ago, that the bone marrow plasma is rich in these substances. And
I want to ask you a question that I know for sure people will ask. I have a lot of patients that don't want to have a spinal tap. They are very concerned about what will happen if they do it. Can they all do the treatment IV only, no spinal tap?
If parents prefer to have an IV treatment only, yes. We do so. We give also mannitol, which opens the blood-brain barrier. So that's something we do. I think nobody has the final answer how important the spinal tap is. We think it's the best way to get as close to the brain as we want. We have not had a single severe complication from this. We are going to publish this. Our anesthetists usually have performed, at least the ones we have performed 2,000 lumbar punctures before they start to puncture our children. So that's quite some experience. And I tell you, it's easier to puncture a child than to puncture an older adult with osteophytes and osteochondrosis. So that's a straightforward thing. And you inject the cells directly to the brain. The cerebrospinal fluid is in motion. It gets the cells to the brain. And there is a phenomenon which is called the cytokines. The cytokines is hormones that are excreted from any wound, any inflammatory process, and it attracts stem cells, and it tells the stem cells here in the left temporal lobe, please come here. We have a problem here. Please come here. We need you here. So the stem cells come here and they do their work here. And that's the same thing that happens any wound in the body that you have. You have a wound in your leg, you have a wound in your finger, and there are cytokines excreted. And they tell the stem cells, come here, we need you to repair the fat, the bone, the muscle, do your job. And then they do their job.
So just to continue the process, now the procedure in the OR is finished. What is happening to this child next?
Well, the child leaves the OR, it has an IV, and the rest of the plasma is infused, which takes about half an hour, 40 minutes. Just let the child sleep, and after an hour, they usually wake up. And we give now, as I said, the dormicum and ketamine. And ketamine really makes them more sedated, makes them more patient. And few children start to cry. There are children who still cry because it's a new environment, but that's a rarity. Most of the kids just wake up and they want to have to nibble a drink from a bottle. And then when they are awake after 2 hours, 3 hours, when you're happy, or 5 hours, whatever that's something we leave to you.
But do they have to lie on their back for a certain amount of time?
No, forget it, not with kids. I mean, this is true for adults, but for kids, it has no importance. We use needles that are thinner than the ones usually needed. Usually it's gauge 18, we use the gauge 22, which is a lot thinner. And the thing is, if you puncture the dural sac, if you puncture the cerebrospinal fluid with one puncture and you're in, there is no fluid excretion. If you do many punctures, yes, fluid may be excreted, and then the headache starts.
Okay.
But that's only
good now to explain what are the complications for dural puncture. So I think just in bullets, so it will be very, very clear. It's a very big concern for a lot of parents.
There is no severe complication. What may happen is headache. We give a preemptive pain therapy. We give Seractil or Novalgine or any of them, well-known, Advil. So, but we give that every 6 hours, so the child never will experience pain. And then we have drugs for vomiting. They may vomit. So we also give them drugs against vomiting. You should not feed them too much, just soup, tea, that's fine. And then they will not vomit. And the next day, usually they sleep well. And the next day, we see you in the office. We take off the wound dressing. And then basically you can go home. You can stay here for another day if you feel comfortable with it, if you think it's more safe to wait for another day. It's okay with us. We are here for any question that you may have in a later stage. And you go back and just keep the child quiet as possible for 2 days, 3 days, and then they live their normal life. And
in terms of flying back home,
yes,
for a child who needs to go on a longer flight, not like an hour flight, how long after procedure do you recommend to go on a flight?
2 days after the procedure, that's perfectly safe. So if you have the procedure on Thursday, Saturday is fine. It's absolutely perfect. No problem.
Can you explain about what happens when you take out bone marrow from the bone? What happens to the bone marrow left behind?
This is replenished within 2 weeks. That's easy to answer. 2 weeks, and it's the same as it was. Usually blood flows in there very fast. The important thing is that the stem cells that are in the trabeculae, in the peripheral part of the bone, not in the middle, but in the peripheral part of the head of the femur, that they are filled up back, and it takes about 2 weeks. But those cells are somehow primitive cells. They propagate quickly, and after 2 weeks, it's the same amount of cells than it was before. So this is not an issue.
So we've heard about clinics before. It does bone marrow aspiration every month for a few months in a row. Is it something safe to do?
I think it's certainly safe. Yes. Why I don't do it is because the effect starts 1 month to 3 months after the procedure. And I want parents to see there is a success. I want them to be happy with the procedure and say, yes, we want another one. I don't want to push them into a second and third procedure. It costs a lot. It costs parents a fortune. And I don't want them to spend the money without knowing, yes, we want it because it's a lot of help to our child. So that's my philosophy. But it's safe to go every month. But I think the effect of a stem cell therapy increases, or it lasts, or it goes for at least 6, or it takes 6 months to fully develop. So in order to see what the stem cell therapy does to your child, it takes about 6 months.
So there's no point in doing it before.
I mean, if you want more cells, the thing is, you cannot inject an endless amount of stem cells into the cerebral fluid, because then the cells would cause a reaction on the brain surface, which would be painful. And it's called the meningeal syndrome, meningitis, and we don't want it. Very simple. So we have to limit the number of cells that we get.
For how long?
I mean, I think this alone would be safe after a month, yes.
Okay.
But as I said, for the effect, for the parents to see, well, this helps. He starts to speak. He is more comfortable with us. He can go to the kindergarten. He plays with his friends. So this takes 3 to 6 months. And then parents come back without us telling them or asking them to come back. They come back and say, we want another procedure. And that's how I want things to be. I don't want to push parents into a financial catastrophe. It's important. It's a lot of money they have to come up for. And so they should be really comfortable with it.
How many treatments can one child do, and how?
4 or 5 treatments. It's not for autistic. Well, let me tell you something. In our statistics, after 350 children, the average improvement is 20 points by the ATEC score. Some have a lot more, up to 50. Some have less, 10, 15. But the average in 300 kids is 20. So that brings the standard child from, let's say, 50, 60 down to 30. And that's a very good result already. And then you may decide, yes, I want more. I want a total improvement. And I can tell you, we have taken our children from the autistic spectrum. We have liberated them from spectrum. No other therapy has ever done that. And we're going to publish this also now, that we have been successful in eliminating the spectrum from kids to make them essentially normal. So this is what can happen. And as I said, you make the ATEC score and you deduct 20 to 30 points and you know where you are, and you should be below 30.
Okay. Another question for you. Let's say we've done the procedure. We waited 6 months, we even waited a year and no success. Should we repeat bone marrow aspiration or should we go for a different form of stem cells?
If we find out that there was a very high aluminum, if we find out there was a high glyphosate, if we find out there's a high mercury and we have to detox, then I would suggest, yes, try it one more time with a lower level of those toxins, and it'll work now. It'll work better. You can, what you have to know is you can't detoxify, or stem cell therapy helps in detoxifying because it replenishes the enzymes to detoxify. If you don't have the stem cell therapy, your essay or attempt to detoxify may be not successful. So yes, if we find a reason for why it did not work so well, then yes. If there is no obvious reason, I don't push parents to do it another time because there may be, that's why it's called the spectrum. There may be certain spectrums of the disease that don't respond to our treatment. We have a 90% success rate, which means there's a 10% failure rate, which is an incredible number for autism. I mean, if you look at ABA therapy, the reported success therapy is 18%, 18. We have 90. So that's a very, very, very good result. But some children may not respond, and that's what happens with any therapy, any medical therapy. No medical therapy has a 100% cure. Nothing. If you talk about whatever disease you may mention, it'll never be 100%.
I agree. I think that at this point, if you want to open the chat
Yes.
and answer maybe some of the questions from there, and after that, I will close the recording and the live feed, and the parents can ask questions on their own.
Sure. Should we discuss the questions in the chat?
Yes, please.
Maybe a good thing to start. What ages are accepted for treatment? We can accept. The best age is between 4 and 10. That's the best age. We accept children starting at the body weight of 12 kilograms. But usually the diagnosis is made at the age of 3. Some are diagnosed earlier, but the average age for diagnosis is 3. So in between 3 and 10, that's the best age maybe. We have treated older kids also with some success, but we don't have the same experience. Nobody has experience with treating 20, 25-year-old autists. There's simply no experience in the literature. How do stem cells get through the brain barrier? Yeah, we puncture the dura. We inject into the cerebrospinal fluid. And so they are where they should be. So they go through the arachnoidea and they go to the brain. We can give mannitol. I don't know if I can answer this here. Mannitol is a drug that opens the blood-brain barrier. And if you give the IV cells and mannitol, this is supposed to help the stem cells enter the brain. But there's another theory that the main effect or an important effect comes from secretomes, from the hormones, and they go through the blood-brain barrier anyway. So, I mean, we do not have all answers, especially in concerning what do the cells do when they're in the brain. We know what they do in piglets. We know what they do in mice. We don't know what they do in children because we can't dissect the children. But we can argue from the experiments in piglets and in mice what happens and what may happen to children. Why do some children regress past cells? Some parents think there's a PANS syndrome after stem cells. In our explanation and our experience, this is when children become more conscious. They realize where they are, they realize their environment, but they cannot speak. And that's the point when they become very aggressive. And that looks like a regression. But this usually, and in all cases that I have heard, that improved after 1 or 2 months. So yes, that's a stage that can happen. And it's a developmental stage when children come back to normal. Why do some autistic children see no progress after stem cell therapy? Because autism, it's a spectrum. Yes, it's a spectrum, and it's not a panacea for all types of the spectrum. It's very rare. As I said, 90% do improve, 10% do not improve. And then I tell you, what we do is we take away the inflammatory process. What the parents have to do is give the children a direction, a new direction in their life, and not just do nothing. If you don't do anything about your child, if you don't give them, may it be ABA therapy, or if you don't give them such psychological support, nothing happens. It's like you put in a new CD or a new computer chip in your computer, but you don't have no program. You need a program for the chip to work. So you have to program the child. You have to work with the child. Without a lot of work, stem cells won't do anything. And that's the responsibility of the parents. But it's not to allow children to do whatever they want. It's to give them a strong direction. You may do this, and this is a no-no. So this is a very important part of the whole therapy. It's always stem cells plus detox plus parental support, parental guidance. If the child with ASD has an inborn predisposition to detox and other metabolic issues, why should more of their own cells? Because we have a repair from the stem cells are new cells. And what you mentioned, they have a new genetic code. The child, an autistic child, essentially has a healthier genetic code. It's not that they're sick as such. They have an inflammation in the brain. And they have now new cells that are only a couple of days old, that have not been intoxicated with mercury, that have not been intoxicated with lead, with plumber, any of these issues, not with glyphosate. They are new cells. So these new cells will improve the genetic code of the cells in the brain. And that's how this works. And we know that because we have done proteomic studies, and we found that, for instance, the level of glutathione dehydrogenase, which is an enzyme to detoxify, it's low in kids below the treatment, during the first treatment. When they come for a second treatment, those levels are higher. They improve to normal. And that's an incredible thing, really. It's something fantastic, and it shows that the stem cells work. How long can you see it affect? As for now, we have not seen a regression after a year or two. I can tell you, not in my experience. I mean, there's always a possibility somebody said yes, but it's not, because they change their genetic code, and then if it's better, it's not a treatment like you give a pill against pain. Ibuprofen, if you give ibuprofen, it works for 6 hours, then it goes away. That's not the same thing with. Can you do IV chelation straight after stem cell detoxification metal? I'll wait a while for the enzymes to fix it. If you have, well, we test for aluminum, we test for any other metal that you want us to test. I would not do a detox without knowing what you do, not without knowing which heavy metals you want to detox. But yes, you can detoxify, and it's probably a good thing. I mean, chelation therapy means EDTA, I guess. For most parents, it means EDTA, ethylene-diamine tetraacetate. It's allowed, it's recommended by the FDA for certain intoxications. And as I say, yes, if we have seen we test in the cerebrospinal fluid. That's something nobody or very few centers have. We measure the aluminum, we measure the mercury in the cerebrospinal fluid. So that's as good as you can measure it. How important is the patient age? Yes, the younger the better. Very simple. The younger the better. Because their number of stem cells is higher. So they have more stem cells to repair. Do you treat CP, and what are the success rates? We do treat CP. It depends. If there is a severe morphological problem, they have no hypothalamus, they have no cerebellum, they have a problem with the pons, we cannot repair this. But we improve the conjunction of the ganglia, and that is something that will improve. But if there is, like in nearly drowned children who have no signs of necrosis of the gray matter, they do the best. So if the MRI is good, the success will be good. If the MRI is pathologic, the success is not so good. I mean, you can give it a try because it's not going to hurt the child. It's not going to make things worse, but the success rate will be worse, or may not be there. You have to try, but yeah. Will the sun ever fix the lack of oxytocin, or will you always need to supplement? We have children that improve in their social behavior, yes. Yes, we have children that improve. We like to recommend the oxytocin, though, but that's not a big issue. I mean, you give it as a spray under the tongue.
Doctor, if you could also send us, and we will post it on a link where you can purchase it. In Israel, you can get all of the iHerb products. So if you have a link from that company, we can pass it on to the patients, and they can... I
mean, you can use this anyway, with or without stem cells, but stem cells will help. It'll make, yeah. My son had stem cells with you 5 weeks ago. He only has a few words. Today, he Sorry, I don't see this. He said, I love you when I said it to him first. Oh, that's very nice. That's I love you. Thank you so much. I mean, we do our work because of such messages. Thank you. Could you explain, as you see, it's 5 weeks ago, so it starts after 4 weeks. Could you explain again which children will not benefit from stem cells? If there are children who are labeled autistic, but they have an underlying cerebral palsy disease. They have a problem in their brain. And if this is the case, they will not benefit from the stem cells. If their MRI is okay, if the higher they have an IQ, the better will be the result. So you may wish to do a genetic examination. And if there is a gene that is clearly connected with autism, it's not the autistic gene, but it may be connected with autism, then I would say use mesenchymal stem cells, use donor stem cells from umbilical cord. Okay? The genetic material has to be in order. Definitely. Can you explain what levels of cell is considered high after this level of glutathione have any impact on this? It's different questions. If there is more than 2,000, we talk about CD34 cells per microliter, okay? Which means 2 million in a milliliter, okay? Per ml. Then, if this is in the bone marrow, that's the bone marrow count, okay? The bone marrow seems to be okay. We found that the number of stem cells in the bone marrow reflects the general health of the children. So the more cells they have, some children have up to 6,000 cells. That's a very good count. But on the other side, we also had children with a low count who improved. As I said, there is 2 different mechanisms at least. It's the cell mechanism, it's the hormonal, the paracrine factor. So yes, we try to establish a connection between number of cells and success. But this is, I tell you, we do a lot of statistics all the time. And it's very difficult to make those statistics in autistic children because it's a spectrum. And it's not a disease like if you have gastritis, yes, you have a disease. And that's it. But with autism, it's a full spectrum. So
okay, I think at this point, we're going to make a little pause. I will let the Facebook and the record go, and people can ask you personal questions.
Okay.
I'm going to thank you officially. We're not saying goodbye just yet, but officially we're saying thank you very much for coming.
Okay, thank you for listening.